time here, right?
It is. I'm so excited.
I think you'll be
Yeah.
pleasantly surprised.
Thank you. Hi. Okay, this looks nice. Gosh, it's really busy. Yeah.
So how do you feel happy?
You
Well, it
are
depends on the day.
feeling close to me. And you tell me.
And we walked all the way around.
care.
Oh, this is a great spot.
What are you trying to learn through your research?
How to support healthcare providers to use best evidence in practice.
So you're trying to learn how people can treat patients better using evidence, essentially.
No.
Oh, okay.
I'm good one. I'm trying to learn what are the strategies that help somebody to change their behavior. Because everywhere you go to work, different people do things in different ways. And they do it because it's the way they've always done it, rather than using the best evidence that we have to make that change.
Okay, so you're trying to help healthcare practitioners change their behavior so that the patients get better faster.
Absolutely.
I know that you say.
So tell me about this awesome mug that you're drinking out of.
You know what? Allison told me about the Prince Edward County studio tours. The first place I picked to go to was a potter who hand molds everything she makes. So it's actually from an old sweater. I love pottery, so that makes it more special. And I want to start learning how to do it now that I'm here.
This is kind of a tangent, but what motivated you to get into that very particular, specific research?
Yeah, that's a great question. I took a course on research methods, and we learned about something called research utilization, and then the light bulb went off because it was like, we've got all this research and we don't use it in practice.
So it must have been a situation of like, you were a nurse in practice, and then you realized there was all this evidence out there that you, who were working on the front lines, wasn't really getting.
And because we're asking somebody to do something different.
Yep. People are really ingrained.
Yeah.
Yeah. You've talked about this a bit already, but how would you describe how your research impacts real life people?
But if we work in a place that's person-centered, then all persons in that context of care will flourish because both matter.
Right.
And so I'm meeting the needs of the provider by supporting them to use best practice, and I'm meeting the needs of the patient because they're receiving that best practice.
Are hard, but if
Lightning round.
Ready.
So I'm going to say two words, and you tell me the one you want. Early bird or nighthawk?
Both.
Oh. Winter or summer?
Winter.
Dog or cat?
Dog.
Text message or call?
Call.
Call. When I dance, I look like...
Erna.
When I grow up, I want to be...
A person that makes a difference.
Oh, my heart is warmed.